there, my name is April and today I will be demonstrating to you an abdominal wound dressing change. So the first thing I'm going to do is I'm going to check my physician's order to ensure that I do have an order for this dressing change. I do. So I've gathered all of my supplies and I'm headed over to the bedside. I'm sanitizing my hands, I'm entering, I'm doing an entrance safety check. Patient is safe, alert, oriented, ready for my interaction. Hi there, my name is April and today I am your student nurse. Can you please state your name and date of birth? Patient states their name and date of birth, and indeed we do have the right patient. Mr. Morris, I'm just here to be changing the dressing on your abdomen. We're going to take off the dressing, we're going to clean it, and I'm going to assess it, and then we're going to put a new dressing on. Is that all right with you today? Yes. Do you need any pain medication before I start? No. Okay, so the patient has consented to the procedure, so we can continue. I'm going to sanitize my hands. I'm going to have my dressing tray here, being mindful of my 1-inch border. I'm going to take that drape away. I'm going to set this up here. Normally I set it up at the bedside, but I don't have a bedside today. Just have that. So, okay. I'm just gonna set up that garbage. Gonna sanitize my hands again. Okay. I have a 30 ml syringe. This is a 20 gauge Cathlon. It's pink. It's sterile here, but it was used, so I would disengage the needle, and then I would put it in the sharps container and have the Cathlon there. But for the sake of this demonstration, that's a sterile Cathlon. I have my Curlex. My cotton tip applicators. Okay, so now I'm just going to sanitize my hands, don on some clean gloves, and I'm just going to remove the old dressing. I'm just removing the old dressing here, okay, Mr. Morris? So I have clean gloves on. I'm just removing the old dressing here. I'm noting that this abdominal pad is saturated with about 30% of serous exudate, no particular odor. These 4x4s are about 50% each with serous exudate, no particular odor, and this packing has about 70% saturation of serous drainage with no particular odor as well again. Now I would just dispose of this and don off my gloves and sanitize my hands. Okay. Now that I'm done, I'm just gonna grab my normal saline and I am ready to, put that here. And I'm just gonna don on my sterile gloves. So now that my sterile gloves are on, I'm able to take my syringe. I'm just going to cleanse the wound. So you're gonna feel a little bit of coldness here, okay, Mr. Morris? I'm cleansing from the inner to the outer until the fluid runs clear. and the fluid has run clear. I can dispose of that. Grabbing these. Just gonna soak up the excess normal saline and garbaging that. Soaking up some more. Not touching the patient. My hands are still sterile. Taking a 2x2. I'm soaking it in normal saline. 1 swipe per wipe, cleanest to dirtiest. We're just going to dry that. Normal saline again, nice and wet. I'm going to just wring that out. Clean to dirty. 1 swipe per wipe. And drying the peri-wound. Okay, now I can assess the peri-wound area. So I'm just gonna look at the length here. The length is about 12 centimeters by 2.5 centimeters, and the depth of it is about 2.5 again, so 12, 2.5, 2.5. Okay, I'm just going to assess for any undermining or tunneling. No undermining, no tunneling. The peri-wound looks good. It's not red, it's not swollen, it's pink. There's granulation tissue in the wound bed and it's pink. It's not red. There is signs of healing, so that is good. I'm just gonna take my Curlex, soak it in normal saline. And with my applicator, we're gonna stuff or pack the wound. So being very careful. To lightly pack this wound. And it's not touching the peri-wound area either. Oh, shoot. So this is not contaminated. I'm just gonna get rid of it. And I'm gonna call for someone to get me a sterile one. And so they did. And this is now sterile again. So we're just gonna try that again. just gonna discard that. I'm gonna use my forceps to help better pack this wound in. Okay. The wound is packed, flush to the skin. There's nothing exposed, so I can get rid of this. Putting my two 4x4s on there. I no longer have to keep sterile. I can grab my abdominal packing. I'm gonna peel that. Put my abdominal pad on there. Grab my tape. Secure that. How was that, Mr. Morris? Secure that with tape. So I'm just gonna clean up here at the bedside. I'm gonna document my findings. I'm gonna lower the bed, put the call bell light, take my don off my gloves, sanitize my hands, document my findings. And, okay, Mr. Morris, I'm gonna head out now. Do you need anything else from me today? No? Okay, so I'm just putting you at the lowest position, call bell light in reach, doing an exit safety check, and I'm done. Thank you.